To answer your question, I'm treating this like a business. This isn't a charity, this isn't a joke. I'm the type of person where if I do something, I'm all in.
This is Entrepreneurs the Playbook, where I give you access each week to the world's greatest athletes and executives about their personal and professional playbook and what has made them champions on and off the field. This is the Playbook.
This is Dave Meltzer with Entrepreneur, and I have Tom Milana, founder, chairman of Man Cave Health. And one of the biggest issues as you get older is prostate cancer. And how many people does it kill a year?
About 30,000 men die every year of prostate cancer.
And how many do you feel are could be avoided?
All of them.
All of them?
All of them. The key with anything is early detection. And when it comes to prostate cancer, early detection is the key. No men should die from prostate cancer, but if you don't know you have it, you're going to die from it. And
Tom, you are an ultra entrepreneur. You had huge exits in your life, very, very successful. What inspired you, though, to get involved and to create Man Cave Health?
So I was diagnosed literally on April 1st. It'll be 3 years. 3 weeks later, I had surgery and I was cured. And I've had a family foundation for the past 10 years, and we've always raised money and donated it to other charities, mainly of children in need. And my family just felt after, I received this diagnosis, we knew one day this would be our mission. And it's kind of my way of giving back. Men are stupid compared to women. They don't go to the doctor. And if we can get 5% of the male population to start going to the doctor that doesn't currently go to the doctor, then I've done my job. So that's our goal.
What inspired you? I think, apathy is the biggest problem, whether it's, financial stuff with athletes. People say we have all these solutions. I said, we have solutions to problems, but you have to actually go. What motivated you to get checked?
So I am the exception. I've been going for an annual physical since the day I got out of college.
Oh, wow.
It's just something that was instilled in me, whether it was my mother that pushed me to the doctor, but I can honestly say that, if I missed 2 years out of the last 30 going for my annual physical, it's a lot. And when I sold my business 10 years ago, it was all about me. I had no excuse not to go to the gym, not to take care of myself, so I started seeing a concierge doctor where I actually got my blood tested 3 times a year. And it was just a personal decision that I made, and the blood test saved my life.
So it was a blood test, not actually a physical exam that you can actually tell by just having a blood test?
Elevated PSA, that's what started the whole process of me going to urologists. So it's a simple blood test that, it's controversial if you do some reading on it, but it saved my life, so there's no controversy at all as far as I'm concerned.
But you agree that apathy is mainly men don't go to the doctor. Is that the real issue? And so what does Man Cave Health do to accelerate or to educate or to inspire people to go to the doctor?
So the first Man Cave was opened on January 6th, and it's a sports-themed waiting room at the Department of Urology in Mount Sinai. And my whole goal and my way of thinking is if I can provide men with a better experience when they do go to the doctor, more men would go. The experience, the healthcare experience, whether you go for a physical or you have cancer, 9 out of 10 times it's a horrible experience. And if you provide a better experience, I think more men would go. And what better experience than to sit in a room in New York City where you have a 70-inch television on the wall, you walk into the room, you have ESPN, you have memorabilia from all 6 to 8 local sports teams, and it just provides not only a better experience, but distractions. There are men in there with cancer. And if they can sit in this room and have a cup of coffee and watch, highlights while they're waiting to see their doctor, I think it'll just take the edge off, and that's kind of our goal. It's all about the experience.
And one of the biggest factors in being an entrepreneur and in life is fear. And a lot of times we put faith in what we don't want, and people, from my own experience of representing athletes, Derek Thomas, for example, he was afraid to have a will because he felt like if I get a will, I'm going to die. And then, of course,
same thing with life insurance, right?
Right.
People don't want to get life insurance because they think it's, they're
right.
jinxing themselves.
But I think the same thing holds true with getting checked. Like, people are afraid. They would rather not know than know. How do you deal with that question or issue when that comes up? What would you tell me if I said, you know what, I'm going to live, let fate take itself. I'm going to live this way. I'd rather not know.
So to me, that's the biggest difference between men and women. I think more women want to know, but men just, for whatever reason, think they're invincible. And when it comes to prostate cancer, once you have symptoms, you're done. It's too late. That's the bad part about prostate cancer. You can get sick with something else and have symptoms, and you most likely could get cured. But when it comes to prostate cancer, I had lunch with one of the most prominent urologists in the country 2 weeks ago, and someone asked that question. He goes, the issue with prostate cancer is when you have a problem, it's too late. I had no symptoms other than an elevated PSA, but if you don't go for that blood test, you don't know you have it.
That's amazing. Because I think that's true in business as well, is if we're dwelling on not knowing the future, you never could be successful. In that congruency, you know, you are a successful entrepreneur, had a nice exit, you scaled a really big business, 10 years ago. How do you equate or align some of the characteristics or qualities that you have into the man cave? Meaning, it's different to scale a charity than it is a business. What types of skills, knowledge that are you using and leveraging from what you learned about building a business into a charity?
So I'm not treating it as a charity. I'm treating it as a business. And it's pretty interesting because last week I had a meeting with Mount Sinai, and I based my personal gift to the hospital based on a budget that they gave me. And a year later, the budget is way overinflated. And we had a meeting about that and how we're going to rectify the situation. And I basically told them, unlike most donors that donate millions of dollars to hospitals, they're not involved once they write that check. They're more interested in getting their name on a building or on a wall, and whatever happens to the money, they're happy. The last thing that's going to happen with any money that I donate for Man Cave is it's going to go in a health system's pocket, right? I want to know where the money's going, because my money could be better well spent creating a brand. Building a waiting room, a man cave, is easy. Getting men to show up is the hard part. And if I'm gonna, you're charging me an extra $100,000 a year in this budget, I could be taking that and spending it on local sports radio, right? Doing things to promote the brand to actually get men to go to the doctor. So to answer your question, I'm treating this like a business. This isn't a charity, this isn't a joke. I'm the type of person where if I do something, I'm all in, right? I don't do anything with one foot in the water, and this is consuming probably about 80% of my time right now. But it is for charity, and it's just, I'm a big believer in karma, and I think if you do well and you try to do well in life, and it'll come back to you in some way, shape, or form.
Yeah, it's interesting. One of the biggest entrepreneurial shockers is, startups that have taken in family and friends money, that have given the money, and they're really not involved, right? In the term dumb money, comes in that respect, that you're taking people's money on an emotional aspect. But then when a company becomes successful and you get a venture capital firm or investment banker involved, they're like you, Tom, right? They want to actually see that this is a scalable model, that we're actually going to be profitable.
Exactly.
We can't just burn through our money. In fact, that term, what's your burn rate, used to kill venture capitalists and investment bankers. In that fiscal side of it, is it a model that you can, with so many people and it's so big, is it a model that you can scale across the country or even the world, or is it just something you want to keep in New York?
Oh no, so since January 6th, I was on live television 3 times that week, and we've probably had 5 to 7 published articles. I've had 5 doctors from 5 different health systems reach out to me about putting a man cave in their system. One doctor up in Rochester actually wants to put one in the local YMCA. He wants to do it outside of the medical facility. He's like, why not hit men when they're going to the gym? Let's hit healthy men. Let's get them to come in for a blood test, before they work out, after they work out. And I thought that was a brilliant idea. Dealing with hospitals can be very difficult sometimes, but I thought that was so cool, having one in the local Y, having a nurse on staff where you can go get information about not only prostate cancer, but other men's health issues, right? Our goal is, it started with prostate cancer because it affected me, but we're about all men's health, right? My mission is not to go on TV and radio and say, you need to go to Mount Sinai to get a PSA test. My goal is to say, just go to your internist, If you live in Long Island, there's no reason for you to go to New York City for a blood test. Go to the doctor, and then if you do have a prostate issue, then you can go to Mount Sinai. So that's kind of our overall.
So one of the great channel partnerships would be sports clips for you, right?
Yeah.
Basically, they used your same model, make guys feel comfortable going to a beauty salon by putting up the TVs. They have their own little man caves already. Be a great key anchor client for you. How long does the test take?
60 seconds.
60 seconds.
Yeah. So normally when you go for your physical, they're not just testing you for your PSA. It's all about
Cholesterol.
your cholesterol. And, ironically, you've had to ask for this test the past few years. It wasn't something that, as I said before,
wasn't it a standard physical?
There's a lot of controversy around a PSA test, and New York just passed a law now where the insurance companies have to pay for it. The problem with the PSA test is that certain people are claiming it leads to unwarranted biopsies, right? If you have an elevated PSA, that doesn't mean you have prostate cancer. And they're claiming that too many people are going for biopsies that are turned out to be negative. They don't have cancer. And I tell people, well, I would have loved the doctor to tell me when I went for my biopsy that I didn't have cancer. So, but
and the biopsy is not a heavily intrusive procedure either, is it?
No, it's not, but insurance companies have to pay for it.
Right.
That's what it comes down to. And this was the same group that 15 years ago said women shouldn't go for annual mammograms. So when it comes to medicine, there's a lot of controversy, but like I said, a blood test saved my life, so no one could tell me any other, it's no good for you.
You know what I find most interesting, because I come from your background in the entrepreneurial business side of things, but now I'm heavily involved in charity. About 80% of everything I do has to have a charitable purpose or cause tied to it, but majority of my time is spent on figuring out how I can be of service and helping people. But what I found is in that area that there's all this economic waste and manipulation. And that if business people don't get involved, it's great, I understand social work and philanthropy, and it takes people to volunteer and sacrifice their whole existence for it, and I really respect it. My mom was a second grade teacher. I consider that a social worker, right? But how do we encourage more critical business thinkers, pragmatic business thinkers, people that look at the bottom line and can see an outcome, like, for example, the opportunity costs of not giving mammograms, or opportunity cost of not doing biopsies, and the small amount of incremental money that it costs. How do we get more business people involved, more companies, not just companies getting involved by writing a check because they get a charitable donation and a marketing halo on themselves, but how do we get more business people involved to say, look, we have to start looking critically at how to raise money to help more people?
I think raising money, there's a ton of money to be raised. I think that the biggest thing we need is to get more business people involved in medicine, like Amazon, like Apple. These two companies have made it very clear they are getting into healthcare. What that means right now, I don't know, and I think there's a lot of charities out there that give good charities a bad name, right? I think the amount of hoops that I started a nonprofit 10 years ago when I formed my family foundation. The amount of hoops that I have to jump through 10 years later to get Man Cave Health a 501(c), it's unbelievable, because there's so many bad charities out there. And when it comes to people donating money, who has time to really do the due diligence on whether this is a good cause or a bad cause, right? And how much of this money donated actually goes to the cause versus, administrative expenses, right? But I think healthcare, as we know it, in the next 10 years, it's changing every day.
Last question, what piece of advice would you give to someone that is a successful entrepreneur, a successful business person that wants to get involved, either create their own 501(c)(3)? What advice would you give them? Would you tell them to create their own or piggyback somebody else's or write a check? What advice would you give someone that really wants to create change?
So unless you have the time and effort to really put into creating your own, I would say don't do it, because it's a lot of work and it's a lot of hours. I'm a person that has always given back in my life, and if you're that type of person, I would just look for, again, for the last 8 years prior to this, we gave money to local charities of children in need, where we can see it, touch it, feel it. That was my whole thing, right? I actually went as far as interviewing some of the kids that I paid for private high school and college. One of these kids actually works for me 8 years later in my insurance business. We gave him a job when he got out of college. So everybody's idea of giving back is different, but unless you have hours and a lot of time to do your own, I would say find a good local charity that you can get involved with in a small way, and make sure that they're doing the right thing before you decide to write a check.
Absolutely. Well, it's really important. Be kind to your future self and do good deeds, whatever they can be. Everybody can't step up as big as you have, and like you said, just 5% change can make a significant difference in thousands and thousands of lives. To take out the dummy tax that most guys have, like you and I. It's a very simple test. Ask for it. Very simple procedure. If they do find it, doesn't mean you have cancer, and even more importantly, it's curable.
It's totally curable, but if you don't know you have it, you're gonna die from it.
I think that says it all. I appreciate everything you do, Tom.
Thanks, Dave.
Tom Milano with Man Cave Health, Dave Meltzer with Entrepreneurs, The Playbook.